Okay, hi. Thank you everyone for joining and welcome. My name is Arden. I'm the CEO and co-founder of Resource Heals. If you hadn't had a chance to see how we turn every patient room into a therapy gym and make the day a better day for your patients, their families, and your team members, please visit our website. I'll do my best to moderate the conversation, and I want to help over 100 registrants that are joining us today. That's amazing. And also thank you for the questions and concerns you raised. It helped us shape the panel and build the content and prepare ourselves for today. I hope that we'll be able to provide good answers, tips, and feedbacks that you will find useful. Before we get started, I want to acknowledge the situation in America today, the suffering of communities and colors. We are all one. And when parts of us are in pain, we are all suffering. As an organization with a mission to change the way therapy and skill building are delivered, we are committing to make the day a better day for everyone with no exceptions and working together for a better future. Today, we're going to discuss the way therapy and skill building are delivered. In that situation, how do we tackle challenges? How do we make sure that we provide a better therapy, better care for our patients? I also want to share that you have the opportunity not only to take knowledge with you today, but also to win a Restore license. So to show our appreciation to, again, over 100 registrants, we will be adding your emails to a raffle. And at the end of the panel, stay tuned. Two of you will have the opportunity to take 6 months Restore licenses. Okay, let's talk about how we can address the challenges of keeping therapy needs for our vulnerable population we serve. We are now 4 months into the pandemic and are adjusting to our new normal, and there's no end in sight. We have an interesting group of panelists here with us today, bringing a wide range of opinions and experience to the conversation, different roles in the skills nursing ecosystem. Thank you, panelists, for joining and accepting the challenge. I will shortly introduce our panelists, and then they will share more about their role and their organization while answering our first question. Andrea Gale, hi Andrea, a VP of Case Management at Marquis Healthcare. Michael Sciacca, COO at Zimmet Healthcare Service Group, and Aaron Crosby, the CEO of Adaptive Rehab, and Ian Oppel, our Chief Clinical Officer at Restore. Thank you very much for joining. Unfortunately, Keith from Genesis, who was an important part of the conversation, had a last minute change. He really wanted to join, but had to cancel. We will do our best to fill in the role and make sure we give the experiences answer that he was sharing with us. So panelists, another new normal, and already we're just trying to understand PDPM and adjust our normal PDPM routines. Group therapy, that's a good example of not happening right now. And now an unexpected pandemic, a curveball. Please, if you only had 1 minute to spend with us, what would be the greatest challenge that you would share with the panel? And please do remember to introduce yourself. Andrea?
Hi, as Eran said, I'm Andrea Gale. I'm from Marquis Health Services. I oversee reimbursement and care management for the organization. My background is in nursing, and I've been in the healthcare administration for about 17 years. I actively love working with Restore from a integrated team approach of a standpoint. It's not an added resource to us. It's part of our daily routine in our organization. And from a 1 minute standpoint of what we have done or what is best to think through this pandemic, utilizing Restore has allowed us the ability to continue to engage our residents and engage our family members in part of the plan of care. We found a big challenge in once residents' family members were unable to come in person, even through Zoom meetings and what have you, it was very challenging to keep them engaged other than just focusing on the COVID piece of it. So trying to make sure we're working through plans of cares and goals and actively being able to do patient and family education, we were able to utilize Restore in a much easy fashion to get that accomplished. So I would say that would be my #1 focus.
Thank you very much, Andrea. Mike?
Hi, Mike Sciacca from Zimmet Healthcare Services Group. We are a reimbursement and compliance support firm based out here in Central New Jersey. I come with a little bit of a different perspective, being that I am a PT by background, but not being on the provider side. I've had the opportunity over the past few months and over the course of the preparation for PDPM to touch base with a lot of different organizations. So, it's interesting. The greatest challenge really does depend on who you're talking to and where they're located. As we transitioned through PDPM and obviously the beginning of this year having, a lot of these issues with the pandemic, the one challenge that's been universal is really how lean the SNF industry is, whether that's nursing, therapy, administration. There's not a whole lot of redundancy. So, the resilience of an organization is definitely challenged when a new set of, let's just say, a new set of challenges are brought upon the organization. So finding diverse ways to address the issues, and as Andrea said, the connection and the communication with families has been of paramount importance. Obviously a very difficult thing when a nursing facility is shut off to visitors. So, finding those connections and changing workflows and what different organizations have tried to do over the past, I guess it's 3 months now, has been interesting to hear, and that's what we're hoping to bring to the table here today.
Thank you, Mike. Aaryn, you've overseeing hundreds of facilities with services you provide, Adaptive provides. What do you see as the main challenge?
Hello, everyone. Eran Crosby. As Eran said, the CEO of Adaptive Rehab and its affiliates. I think the greatest challenge that we're seeing right now has been staffing and providing functional treatment sessions outside of the gym setting. As you said, we're no longer allowed to do group concurrent or strongly suggested against due to the spread of this virus. So we've had to redo our staffing models in many different divisions to avoid sharing evaluators and staff between facilities and COVID positive sites to reduce the risk of spreading the virus. We've had staff members that are off on quarantine, signs or symptoms that we've had to bring in PRN or, try to hire and onboard staff members. And, with a lot of these background check places and such that are shut down, it's just been a hard battle to even get staff in the door during this pandemic, as much as people want to work. The other challenge is just, providing functional treatments outside the gym. We're used to bringing, as therapists, and I'm a therapist myself by trade, used to bringing, patients down to the gym and doing, different workouts and using the equipment in the gym. And we're not able to do that right now. So it's, how are we, providing quality functional treatments inside of, the patient's rooms when we, can't haul this equipment around. And, Restore's been a great tool to assist in that. It's portable, as you can see in your background you're on. It's on a laptop that we can bring down the hallway, bring to the patient's room, and do functional activities and get the patient still getting up, getting out of bed, doing interactive activities and balance and therapeutic exercise and multiple different things that, instead of just, your typical, let's bring some ankle weights down to the patient's room and do some long arc quads or a respirator. So I just think it's definitely providing a much higher quality of treatment during this pandemic. Thank
you, Aaryn. Ian, I know what my greatest challenge, seeing the beginning of a pandemic for Restore, but I would love to hear yours.
All right, good afternoon. And thanks for including me on this esteemed panel for a discussion I'm really passionate about. My name is Ian Oppel. I've spent the past 25 years in the post-acute care space. I'm an occupational therapist and the Chief Clinical Officer with Restore Skills. I've been a dementia-capable certified therapist for over 20 years, so my clinical passion has always been to advocate for our most vulnerable older adults with dementia. And from a big picture standpoint, I think our greatest challenge today is to actually increase our advocacy for our population most vulnerable to COVID-19, as family members and friends remain restricted from visiting and advocating for the care of their loved ones. You got more than 2.4 million people living in long-term care facilities, roughly 15,000 nursing homes and 42,000 assisted living communities. We've really been entrusted with a great responsibility and an escalated need for transparency and accountability beyond what we've previously known.
Thank you, Ian. Well, for me, the biggest challenge or change is with our first 200 facilities. We visited each and every one of them in person. We were working with patients, with team members. We had a great opportunity and privilege to do that. And suddenly we cannot visit facilities anymore. We actually are, the two last facilities we added in Chicago, we were the last two vendors, people that were able to come in. And we, back in the days, we dreamt about being able to onboard facilities online with remote training, and we're happy to see that that's working. And actually, we see the same usage from facilities that were onboarded in person versus facilities that were onboarded online. But having the privilege of visiting 200 facilities, I would have to say that, guys, I miss working with your patients. That's I'm not an OT or PT or speech, but it's wakes me up with a bigger smile in the morning, and it's a privilege to do so. What keeps me up awake at night is I would want to know. I think we all want to know what's going on through the minds of our patients. 4 months into isolation, no visitations, and not all of the therapy gyms are open. What do you see that is going through the minds of our patients? Andrea, I would love if you would be the first to answer here.
So I will say it's definitely a mixed emotion. I think our longer term population, obviously, that are used to seeing their regular loved ones visit often and coming in to celebrate those big moments in life, such as birthdays and other big celebrations. It's been very difficult and a very long journey here as we're rounding into the 4th month here. I think that we've definitely have seen an increase in obviously some depression, some increase in definitely other comorbidities occurring from patients not having as much engagement of wanting to participate in other such activities that we have tried to engage throughout our facilities. I would say our short-term population, excuse me, our short-term population from a more of a challenge is they're dealing with the worriness of, now I'm in a nursing home, I don't have my family member to come sit by my side or advocate for me, or the point of it, maybe they have dementia of some nature, and now we're not able to loop them with their family members, so they feel like they've been abandoned or left, or no one's ever coming back again. So really trying to work through those difficult conversations of making sure that they stay as long as possible to make sure that they're safe and have a good discharge put in place, and that when they do get to return to the community, that it's the best plan for the patient and not rush that experience. And for our long-term population, trying to work through ensuring that we're engaging them through multiple different avenues so that they are not feeling isolated with having to be stuck in their rooms or not having our community dining open or other community activities. So working through those have been definitely some challenges, but I think we've rose the challenge, and utilizing Restore and some other avenues has been most beneficial.
Thank you, Andrea. Any Aaron, Ian, Mike, any additions to what's going on in a patient mind right now? Feedback from facilities?
Sure, I can speak up for a minute. I know that, there's been a question, is therapy essential? Is it a non-essential worker? Should they be in the building? Should they not? That was, definitely brought up in the beginning with the social isolation and many things. And, I think now more than ever, we definitely show that the therapy needs are there and they are essential employees. We're seeing huge declines in our functional status of our long-term care patients. We've for 6 to 8+ weeks, we've had patients that were, ambulating throughout the building, going to activities, going on outings, going out with family members, those even in wheelchairs that were, used to wheeling down to the dining room to eat or going to see their friends or just visiting with the nursing staff. And, they're no longer able to do a lot of those things. And, I can just say for myself who likes to work out, I noticed a big difference after 6 to 8 weeks of not going to the gym. And I'm, 38 years old. I can only imagine being 80 years old and being stuck in a room or a bed for 6 to 8 weeks and what that, does to them physically. So we're definitely, trying to get out to their rooms, trying to provide as much treatment as we can to a lot of these patients. As well as the short-term skilled patients that are coming in, we're getting facilities that are accepting just COVID positive patients only or going to COVID positive facilities. And we're seeing the effect that had on them and what we're having to do for rehab. We had one of our buildings that initially were taking the approach of, holding off on therapy. And they started to realize that, the patients were getting worse and they implemented therapy back in to the COVID patients and started seeing definitely some increase in functional status much quicker and recovery quicker with the added therapy. And I think Restore is definitely helping with that. We're able to bring the gym to them, reduce, bring in, multiple pieces of equipment around. And as well as, I think that Andrea made a great point that, with these residents being isolated and their loved ones not able to come visit them, we've actually used Restore to send out a link and doing trials with their, family member, watching them do an activity, watching them exercise, be able to comment on that and interact. And it's made a huge positive outcome of some of our residents just having that FaceTime and not just, being able to have to do it on a phone, but to see their loved one and interact while they're doing something has even helped, the family member feel better about, mom or dad or grandma that they're doing okay and being able to see how they're doing. So it's definitely been a challenge, but I think that we're battling through it and it's getting better.
I could just add to that. There's really no team better suited to mitigate the physical, cognitive, and psychosocial risks of isolation than the rehabilitation team. Therapists absolutely can add immense value in this new normal, but it's essential that they're afforded the time, the tools, the training, and the support. But in return, therapists, we do have to be open to changes in our current care delivery model. We need to think about staggering schedules, to have an extended presence beyond a typical 7 to 5, where the majority of our services were delivered between 9 and 3, less resistive to change, and really trying to ensure that our treatment sessions demonstrate resourcefulness, meaning, engagement, and as much as possible fun, not just going through cookie cutter routines, I think, as Aaron had referenced before. As therapists, more than ever, I think we have a responsibility to connect families and friends of loved ones with video chat in any way, shape, or form, to really build trust through transparency, allow for encouragement, and to provide an opportunity for ongoing patient and family education and training. I know that the big word in my mind is anxiety, and what can we do to put on that positive face and reduce that anxiety and get people immersed in things other than that level of isolation.
Thank you, Ian. We're receiving questions from participants. We will make sure to answer as many of them as we can before we conclude the panel. And if we won't get to your question, we'll make sure that the panel answer that later, and we'll send an email to everyone with the answers. It was a relevant question to what we just discussed. The therapy is essential as we change how therapy is provided. How can we expect restorative nursing to improve?
I think on my end, as far as restorative nursing, we're actually doing some trials that we're developing programs with Restore, and the therapist is making the program set up so it can't be changed, it can't be altered, and what they feel comfortable with the restorative staff carrying out. So they're doing a lot of training, setting up programs, and it's been great. The staff gets involved. They have a fun time interacting with the patients, and they're putting it on a cart and rolling around the building and doing restorative therapy. We're training some activity staff members in some of our facilities in Ohio that are using it for activities and getting people interacted together in group sessions and exercise sessions. So I definitely think that Restore's helped with that. Sometimes we get a lot of our long-term care patients that just tell you to get out of the room, or hey, they're tired today, or they're not feeling up to it. But some of the games that we've been able to develop with Restore, such as the slot machine or something that they used to like to do, I think that's probably the biggest one. One loves to gamble, so they're more likely to do a lot of these activities because they feel like it's more of a game or something they enjoy versus an exercise session. So definitely seeing some positive results on the restorative side as well.
I would definitely agree.
Yeah, and I think that. No, go ahead. Go ahead, Andrea.
I would say I would definitely agree with that, and mimic off of what Eran's saying. We definitely have gone that same kind of flow of building and having it integrate with our EHR system of utilizing Restore so that we can have multiple patients work through their plans of care, and then as they get more at an independence level, transitioning them over to allow them to do it on their own and utilize, we have additional Restore locations throughout the building that they can go and utilize and maximize their time while they're with us. So those that have been, kind of cleared to be independent are able to, once they've kind of graduated to that level, be able to use it in a more general setting once they've been allowed, obviously post-pandemic. We've definitely been able to still continue to use it through this isolation period of having them, obviously utilizing laptops and what have you. So that's been obviously instrumental in continuing therapy and those touch points. We've also began using it as a streaming mode. So we have it streamed over one computer system in our facility, and then it will stream over our TVs, so we can do a group exercise program where everyone still stays in their room and everyone can still participate. It's not from a billable standpoint, but it still gives them that interaction and feeling as though they're with their team from missing out on those group activities. So we still have we do a leaderboard, and we kind of share an update, and some of our patients get very competitive in regards to how they're doing. So that's worked in from an engagement standpoint as well. Thank you,
Andrea. Mike?
Yeah, and I think it just speaks to the bigger picture of the goal of our intervention is to get people active, right? So who gets somebody active? It doesn't have to be a therapist, doesn't have to be someone with a license. I think the one thing that I've been speaking about since before COVID and really with the implementation of PDPM was, we were so tied to therapy minutes that's kind of all we knew. And essentially a whole generation of therapists only knew that. And that's how workflows in the facilities kind of adapted. But, PDPM, if it did anything, was to release, that direct tie to skilled minutes and give us all flexibility to be creative. So, the pandemic has only exacerbated that, where you have to be, by necessity, creative to keep people in.
So I lost Mike.
Let me try to jump in with I think the point that Mike is in the middle of making, and see if we can get his audio collected back. I think we pride ourselves as an industry as being integrated, but the truth is that there's a lot more individual competence than collective competence. And so if instead of just thinking about what's restorative's role, what's nursing's role, what's therapy's role, what's activities role, et cetera, we really should be thinking about collective outcomes and the way that each person can contribute, and that it's not enough as an occupational therapist to have a successful session. It requires everyone to engage and have success, and that we share that success.
Mike, maybe now you can continue where we lost the end. Okay, so just to make sure, can you hear me? Nod your head. Is that okay?
Yes.
Okay,
Yeah,
perfect.
I can hear
Thanks. So we'll jump to the next questions. Well, we all understand the connection between census and business development. That's what keeps us alive. You know, with the reducing new admissions, the media is not a great supporter this time with skilled nursing facilities in terms of marketing and positioning. Let's talk about the path to recovery. What should provider message should be to patients, families, referral sources, and yes, how has your approach changed? What do you find working right now, and how are you involving team members in the marketing approach? Mike? Okay, so we still have issues with Mike's audio. Andrea, can...
Sure. So I think our position has changed in regards to it's even more than ever before important to have good outcomes and speaking and sharing your outcomes from a patient standpoint, from a different population standpoint. Now having this new type of patient population regarding COVID and those that have other, clinical comorbidities, of being able to kind of produce that data of what you're doing and how you're managing that population. So I think being very transparent, putting out there and making sure everyone's aware of what systems and or approach you took to your infection control processes, what safety nets and guards you've put in place in your facilities, in regards to making people feel as at ease as possible. We've gone as far as taking the approach of doing virtual tours, live virtual tours, not just pre-recorded ones, so that they can see the facility layout and what items that we do offer and how we're obviously working through the isolation period, because many of the questions we've gotten is, well, why can't I just go home and sit in a room? Why do I have to come sit at your facility and sit in a room? So being able to really explain to them the value out of having the integration of the IDT team and the different roles within the facility of what nursing can bring to the table, what therapy brings to the table, and still the activities and the diet, the diet standpoint of that is very important into the road of recovery, and also making sure that they won't have that, that added risk of returning to acute if they were to go home too soon. And so trying to really sell that message related to that, as well as what value add would be in terms of the outcomes we have seen for patients that do come to us for a short period of time and then have been able to transition back home. We've been able to really share a lot of data that way with our referral sources, with other patients or potential patients, and that has definitely been ideal. It's definitely still been a struggle for sure as things have changed, and we are facilities that are open to taking COVID as well as non-COVID, and so making sure that we have that very clear-cut guidance on where those different portions are in our facilities, so that patients do feel comfortable when they're coming in, and or their families, that when they're dropping them off, how they feel about that.
Thank you, Andrea. Mike, we lost you in the middle of your answer.
Yeah.
Somebody, refer maybe to both or just your understanding of how do you see facilities handling business development, marketing, and getting team members involved.
Yeah, I mean, I think that, and I apologize for that, for getting dropped off there. But you know, I think that the you know, the social media and the digital marketing of the successes is what you know, we're seeing a lot of. You know, I was telling you guys, you know, one of my good friends down in Louisiana, administrator down there, him and his, you know, small home, but him and his entire, well, most of his staff kind of locked in with their residents for 57 days to keep you know, the virus out, and obviously with no visitors coming in, and you know, the needs of the residents being paramount. You know, they took a pretty aggressive approach here, and those are the stories we're not hearing, you know, on the news. You know, those are the stories that from a marketing perspective, you know, the disconnect between families and their loved ones is one of the biggest complaints that we've heard. Even, you know, even a staff member here at Zimmet Healthcare, one of her dad passed away, unfortunately, during this, and you know, the biggest complaint obviously was the communication, or you know, lack thereof. So you know, marketing and you know, focusing on all the good things that we're doing as an industry, I think needs to be front and center. So you know, I think that those items are the ones that you'd want to obviously emphasize, and I'm sure there's many different examples of that going on throughout our industry.
Thank you, Mike. Next question is about staffing and resources challenges that we all understand. The question is individual or collaboration approach. What is your point of view? Aaryn, can you please take that?
Sure. Obviously, I touched base a little bit earlier on the staffing challenges of, you know, the inability to share staff. You know, a lot of times in the therapy world, you know, evaluators are going to 2-3 buildings in a day and making sure plans of cares are set up. And you know, right now, we're just not able to do that due to the virus. You know, but not only our staffing troubles, but the staffing troubles of our operators. You know, getting STNAs in the door and laundry and housekeeping and many other things has just been huge that we've seen on the operator side. And it's, you know, us as, you know, my therapist, myself as a therapist included, you know, are a little bit high maintenance sometimes, and I'll admit that. But what I've seen throughout this pandemic has just been phenomenal. I mean, a lot of our therapists are, you know, reaching out and asking if they can go in and help with laundry and help, you know, pass lunch trays and many other things, you know, be an STNA and such. And it's, you know, been phenomenal. I mean, we're doing that across the board. I mean, we're in this together with the operators and, you know, our customers, because in the end, you know, why we got into this was to take care of patients. And the more that we can do right now to be a team, to make sure that our you know, end result, our residents are getting the best care possible, you know, we're going to do. And it's just been phenomenal to see the collaborative approach between, you know, multiple different vendors and companies coming together and doing what's best for everyone, and not just worrying about their own company or their own end bottom line. So it's been truly phenomenal.
Andrea, I know, you know, what's your point of view. Coming into a Marquis facility, you immediately feel at home. So if you can just share with us your point of view and approach.
Sure. So, I mean, I would agree with Eran. Our therapy provider was definitely hit hard in regards to not being able to share. We have a number of buildings that are very close together. So there was a lot of that going on. When we kind of locked things down, and not even just from a therapy perspective, even from a organizational support structure. We have a vast amount of corporate organizational structure people in place, and a lot of us float around quite a bit. And so when we were all kind of assigned and not able to do that any longer, it was a huge hit from a hands-on perspective. So we definitely, you know, tried to work our best of how the teams in the facilities really did amazing with collaborating together with those parties that were still in-house. Rehab in a lot of our cases in our building stepped up and did participate in direct care in a lot of cases, and, you know, doing ADLs and making sure that, you know, they were trying to work with patients and stick with our assignments as much as possible. But, you know, at some points in times we were only even allowed to share them inside the building amongst floors. So it got very tricky in regards to that. So doing a lot of supporting of each other, of doing telehealth and helping, you know, walk around and hold the iPad so physicians can make visits and stuff of that nature. Everybody really has stepped up and thought outside the box. And we really have tried to look at all roles as much as possible and look at what availability of resources they could bring to the table. You know, we've seen administrative staff that work typically behind the scenes in the offices step in and go get certified to be able to be certified feeders. And we've utilized others from the field that can't get into the hospitals to help support making follow-up calls or visits, virtual visits with our family members. We've had a number of our liaisons who got well versed at using Restore, and we're helping us go around and have the residents be able to do virtual joint visits on Restore with our residents. And so it's been definitely an all hands on deck approach. And like Eran said, there wasn't another way around it. And I think the one good thing definitely came out of this is watching the teams come together and really try to work through this and survive this. So it was very, very heartwarming to watch.
Thank you.
Yeah, and then I'll add just one more thing, and something that came out of this, and, you know, a lot of the calls that I was fielding from clients, you know, really tied into, you know, the evaluating therapist not being able to kind of, or being prevented from coming into, you know, multiple sites. So, you know, if anything good comes out of this pandemic, you know, I think from a therapy perspective and the telehealth standpoint, you know, that is going to, again, allow us all to be a little bit more creative in how we address things, how we set up plan of cares. And, you know, this is all really tying back to, you know, such a rapid growth in technology. And, you know, whether that technology is to make our lives more efficient or to increase kind of the connection between institutions and families, I think that that's going to be one of the long-lasting, you know, impacts of what we're seeing, because, you know, like I said, you know, I haven't been in my office. I mean, I'm here today, but I don't think I've been in my office for, you know, 3 months, and I really didn't need to, because, you know, most of my work was on phone calls in my shed. You know, that's kind of how, you know, where I was taking a few of these calls. But, you know, that connection, the Zooms and the Microsoft Teams, you know, those have all been used in almost every aspect of our lives, from, you know, happy hour to our kids, you know, education to, you know, work life. So I think you're going to see that, and it's going to probably touch on a few more things. The technology and the interaction with our families and our residents is something that's going to be long lasting out of this.
Thank you, Mike. I think, you know, I shared that story with you, but I was relocated to the US from Israel about 4.5 years ago. And before moving to the US, I used to visit the US about a week every month. And when we decided to build a US company, I told my kids, look, we'll be in the US, I won't have to travel that much. And I had no idea that when you're building a company in the US, you basically live on a United airplane. And in the past 3 months, they told me, hey, Dad, it's the first time you're actually staying at home. That's, well, Mike, you know, in our former conversations, you noted that it's tough to say whether it's a function of technology / hardware, or if it's just not baked into our staff workflow when we speak about technology. So can you please explain what's your point of view? Is it a technology end? Is it the human force and time and efforts? And I think that, and again, we all understand that technology is going to play a bigger role moving forward.
Yep. Yeah, and I think what, you know, my point was with that is, you know, and really the connection. So whether it's connection with the family member for short-term residents, or whether it's connection with, you know, loved ones for our long-term care resident, you know, for lack of a better way of putting it, we've been kind of old school for a while, where the social worker, the admissions person would be making phone calls. But as you can see, and even in daily life, with us at home, the FaceTimes and the Zoom calls are the ones that we're using all now. So it's a function of, is it a hardware issue where like facility staff don't have the hardware to actually, conduct that, or the time to really set it up, getting family members contact information, know when they're available, or is it just not built into our workflow? As therapists, we spend a good amount of time with our residents, whether it's in the gym or in the room or what have you. And, a 5-minute FaceTime call, I got my phone right here, I can do it at any time. It is probably something that we'll see a little bit more out of, to connect family with our residents. If anything, I think, building that into the workflow is something that we're going to be forced to do, because what we'll find out of this from the negative side, unfortunately, is that we were so lacking in the first few months of the pandemic in having that communication, that we'll go kind of, 180 degrees the opposite direction and really be, trying to overcompensate for that, and to reach out multiple times just has to be built into our workflow. So I think the technology is something that we have, we all probably have it in our hand right now. But, whether or not it's built into our workflow, I think that's the bigger issue that we're going to have to address in the coming months.
Thank you. And I was lucky to meet P.N. Oppel about a year ago, and have a conversation about a transition from a role in operation to taking a role in a startup company. One of the things I miss most about traveling to facilities, fighting with him in the car while we drive 2 to 3 hours between facilities. And so if you can share a little bit about that, the difference and the experience between being in a role in operation to joining a digital company, and how do you see that we can help tackle those challenges?
All right, and if you can't hear me, just raise your hands up in the winning position, so I know you can't hear me. But I was most surprised to experience the intentional, but more the unintentional resistance to technology adoption in healthcare, and that the challenge really wasn't that unique. Being on the provider side, I always looked for innovative technologies that could both accelerate and elevate clinical outcomes, customer experience outcomes, reduce costs, and kind of work simplify for our teams. Some were more successful than others, but the common factor was usually having a champion who was committed to trying and working through any challenges before succeeding. It's rare. No one likes to allocate time for training and adoption. There's a little term you may have heard of called productivity, and certainly not to look less than competent in front of patients and coworkers. It's important not to apply a false pressure to have to be perfect. I conducted a virtual training session recently where almost nothing went as planned, and was literally sweating at the end. I heard the patient exclaim, "That was so much fun. I haven't skied in years, and I can't wait to tell my grandson what I did today." And I just realized, wow, it doesn't have to be perfect. So I've come to that realization that, technology is innovating faster than ever to solve problems. And most of the times those problems are created by people who are resistant to technology. So I really would just encourage everyone to realize it's time to become an active part of this innovation, evolve with technology, or really risk that components of your job, or maybe even all of the functions of your job, will be replaced at some point by smart learning.
Thank you, Ian. I think that we started covering technologies, and would love to hear how is technology changing every day's operation? What technologies do you guys use and have in place and taking advantage of prior to the pandemic, and what are new technologies that you are using now? I think, what are the give us the good and the bad, the honest feedback about what's working and what's not working as technology for the facilities. Andrea, can we start with you, please?
Sure. So I would say to start with some of the good things, I think, and to mimic off what many of you guys have said, is that through this whole experience, you know, as an organization, I would say we're very technology forward and very comfortable with technology. All of our facilities are on EHR systems, and most of which are paperless at this point. And we are fully integrated into everything and anything we possibly can be, to try to make life more flow easier for our clinical staff, as well as be able to work with our upstream and downstream partners and not have any break in communication. As much as we were so technology sound, I would say, it was very eye-opening. There was still lots of gaps when this all came to be. And really the touch points of patient experience or making sure our families were as comfortable and updated as possible. So we really looked to add other entities in regards to, we had already been using a software related to VoiceFriend for multiple avenues to communicate with our staff, but also instituted that to communicate daily messages out to our families and giving them updates from a general standpoint. So I do feel as though, yes, the individual calls are important, but also having that just update to know everything's okay. And this is what's going on in the facility from a general standpoint, as also telling them what's happening today. So what will your loved one be doing today? What kind of activities will they be doing? Just to make them feel at ease. They're not just sitting and being left in a room. And so I think that really brought some, calmingness to some of the family members. We really have gone full stream with utilizing Zoom and other FaceTiming kind of options for our, obviously, care conferences and or those patient and family engagements with our teams. I think the most biggest change was with our providers, so our physicians and our medical teams, many of them going to telemedicine themselves, and still continuing with our rounds and our focused kind of visits with them has been a different change in regards to how we obviously accomplished it, but definitely seen an increase in visits from a physician standpoint, making it they're able to see a lot more patients than they were in person. And we haven't seen really impact to what we're getting from an outcome standpoint in regards to that. So I think we'll see it. I definitely think that is somewhat will stay in place. I think as healthcare continues to grow and innovate, they'll see the value added in that. I would say from a specialist, we have a lot of specialists that come into our facilities, and when this all hit, that was probably the hardest hit of not being able to have our cardiologists and our neurologists and stuff come on site. So continuing to do our rounds with them has been instrumental, and we've been able to have them see and absorb amount more patients than we would have been able to see in person. So it's opened up avenues for multiple different parties to be able to be on a team meeting at the same time and be able to have schedules more work easier than trying to schedule getting everyone in person. So we've seen that grow. We've expanded our use of VoiceFriend for post-discharge, so allowing patients and setting that up before they go home. As we all know, many people have smart devices, more so than ever now. So we can set up reminders to make sure they take their meds once they're home and preset those up for Alexa to remind them, or remind them to do certain activities. So we've really thought outside the box in regards to how can we do those type of things prior to going home, and setting them up in their rooms for them to be able to demonstrate before they discharge has been ideal. We utilized and have worked with Restore to grow a Restore to Home, which is probably one of my biggest passions behind Restore, and allowing our patients to start using Restore and get transitioned down to a less skilled stay or skilled level, and then go show and demonstrate while they're still with us that they can follow their plan of care and their outlined activities that has been implemented for them. And then we can follow them post-discharge and still follow up on their activities and how they're doing and progressing while they're home for those 30 days. So it's been able to allow us to track them even post-discharge and then still communicate with them. We used to have them come in person and do a graduation kind of experience, but we've been doing that via Zoom now, and still really celebrating and then making sure that they get that weekly touch point via video conference where we're integrating that with the family members. So I think technology has definitely grown its heels into the ground when it comes to healthcare. So if you're not on board with it, I don't know if you'll be keeping up with the modes of where it's all heading.
Thank you. I want to, we have 10 more minutes. I want to jump to the next question, which I find interesting and challenging. You know, enrolling new initiative in a big organization is a challenge to begin with. And now during the pandemic, we have even more challenges doing that. I think Aaryn and Andrea, your organizations were, I think, of the best to enroll and implement and onboard our platform into your organization facilities. I would love to hear, you know, a new initiative. Is it difficult for everyone? What are the strategies that you find that are working in implementing, and share from your experience, please, about the successes. Aaryn, your company has team members nationwide. It's adding to the challenge. Can you please share with us?
Sure. Yeah, I definitely think the technology part is hard for some of our therapists to use and get used to. So what we decided to do is take some buildings and trial with in different areas and different companies that we know are pretty tech savvy, and roll it out with them first and get the results and get the peer buy-in, and have them help, then work with other fellow therapists and co-workers on spreading the word on what they've been able to accomplish. And it's really done well that way. I think that, we've had other technology in some buildings that we put Restore in. And I think the one thing that we found with Restore that the therapists love, and we got a lot of buy-in on, is, the ability for it to be on, their laptop that they use, every day. And they can just pull it up. They can take it to the room of the patient they need to go to, or the other room. They're not having one universal device that they're stuck with, that every therapist has to share every patient. So that's been a big help in the buy-in, is the ability for them to use it on their own personal, well, I should say company device, but their personal company device, and carry it around the building. It has been a big help. And also I think the technology and the ability to track and grow a patient through different levels of difficulties and such within the technology, and get that feedback of the progression of the patient has been a big help with, documentation and improvement and functional activities and balance and such. So I think that, just getting the buy-in from certain, your top therapists that do well with technology, and have them train others has been great for us.
Perfect, thank you. Andrea, can you add here, please?
Sure. So I would mimic much of what Aaryn had said in regards to getting those lead champions that are comfortable utilizing it really with our approach, and kind of starting off with some key players in certain buildings, and we kind of selected them across each of our markets. And then really we did a lot of peer communications. We have a group call once a week with all of our therapy teams during their lunch period, so we can get everyone hear about what's working, what's not working. So from therapist to therapist, they can speak to, if they're having a challenge, what we can do to help, and what's worked in another building, or people chime in and say, well, I tried this with this patient and it was able to work. I think there's been, those few that maybe are very resistant to the technology piece, but once you get them using it, I think they find it's very user-friendly, and once they're comfortable with it, it really takes off from there. I think I've found, definitely from a standpoint of the facility engagement, so it wasn't just a therapy item we rolled out. And when we rolled it out, we took that approach. It's not just something we put in place for therapy to use, and we took that very strongly, of making sure all our activities people were enrolled and knew how to use it, and their teams are educated on it, as well as our case managers and care navigators. And we've gone as far as putting it on any device in our facility, and adding multiple stations throughout the facility. In some of our buildings, we even have gone as far as, like I was saying, and sharing it across streaming across the televisions and what have you. So we've tried to make it so available that is part of the daily routine of, it's the default item to go to if there's, a need of wanting the patient to be either entertained and playing what they think is just the slot machine game, or how they're doing in regards to from a therapeutic approach. But all in all, it's really helped us in getting the engagement across the organization.
Thank you, Andrea. So I think to summarize, it's setting the goals, providing the right hardware, and then teamwork and giving the time for the team members to train, maybe from, you know, with the vendor, or even better, a peer-to-peer work. I want to close on a positive note here. John Karansky had the Quarantine amazing YouTube series, Some Good News. What is the good news your organization is focused on during the pandemic, and how have you kept the morale up, and how do you see the good news impacting us moving forward? We literally have 50 seconds for each, and I would love each and every one of you guys to answer that question. Mike, the good news.
Okay. Good news. I think there's more good news than bad news when you start hearing stories from across our industry. So, you know, the good news, they're countless. Really, you know, the administrator, my administrator friend down in Louisiana, to, you know, our therapy teams that are, you know, covering for one another and, you know, shielding, you know, some of their staff that, you know, that are more susceptible to negative impacts of the, you know, so you're hearing those stories from the frontline workers that have gone in every single day to take care of our sick and vulnerable population. So, you know, to try to address almost an impossible situation with what we've been able to do, I think that's a positive story.
Perfect, thanks. Aaryn, good news from your end?
I think the good news is that we've seen, you know, our company come together as a whole and to help one another, to make sure that, you know, our patients are getting the care that we need. You know, we started, you know, highlighting COVID positive patient success stories and in our newsletters, and, you know, a superhero campaign where their therapy staff on the front lines are nominating each other for going above and beyond and throughout this, and you know, highlighting in therapy programs that have been just battered with COVID, and, you know, having to don PPE, you know, and go through, you know, plastic walls to treat patients, and, you know, and provide them with recognition and such. It has just been, it's been awesome just to see the therapists band together and nominate each other and help each other. You know, we did a lot of corporate videos of saying thanks, you know, to the employees out there, and learned, you know, how crucial it is to support, you know, your frontline staff now more than ever, and how, you know, crucial they are for the success of a company. And, you know, I just think it made us realize, you know, more so, like I said, now than ever, on how important employees are, you know, during these things, and how, you know, we as a company need to show appreciation.
Thank you, Aaryn. Andrea?
So we've done a lot of those similar things. I think one of the things that I would say stand out is really from our frontline staff standpoint, and saying thank you and recognizing them is in our newsletters that we do send out. We've increased those to more frequent communication and doing them in much more electronic format. One of the kind of components is doing the same superhero kind of concept, but is getting to know the superhero behind the mask. And so it's been the campaign, and really getting to know those that have stepped up and really spotlighting them has been huge, and to the point where sometimes our newsletters is so long it's becoming a book, because there's so many superheroes that really have stepped up through this whole thing. So that's been really exciting to get to know in a deeper level all of those that you're sitting and working side by side with through all this.
You're on mute, Eran.
Yeah, thanks, Ian. In 1 minute.
I just want to share a good news, feel good story that happened this week. Restore, we have a simulated slot machine game. It's called Jackpot. It's our most popular game. Players work on range of motion, coordination, activity tolerance, while getting immersed in the effort to win big. In fact, if you hit wild, you hit our jackpot and you actually win. And I hit the jackpot with Restore t-shirt, and we received a story this week of a player with limited shoulder strength and range of motion who became determined to win a t-shirt after seeing another player wearing one in the facility. He played with therapy, he played with activities, he played on his own, he added weights on his wrists, and unfortunately he never hit the jackpot, but he did increase his shoulder strength and range of motion to the point that he could independently comb the back of his hair and reach for items that were hanging in his closet, get his shirt on and off. We shipped him a shirt anyway because that is the real jackpot. So that was a great story for us.
Thank you, Ian, for sharing that. And we love those stories coming from patients and facilities and team members all around. We ran out of time. We have a few questions from the panelists. I will share them in an email to the panelists, and we'll send them to all the registrants when we have the answers. We would also do the raffle separately, and again, share an email with who are the two winners that received the 6 months restore license today. I want to thank the panelists for the involvement, the effort, spending the time with us in preparation, and being here today. And thanks to all the participants that participated, and hope for more good news. Thank you very much.
Thank you.
Thank you.